the state says expanded testing partly plays into the number of new cases they're announcing each day. Today it's 311.
And that brings the total number of cases in Rhode Island to nearly 3,000. Sadly, the health department says another 10 Rhode Islanders have died from COVID-19 complications, bringing the state's death toll to 73.
The health department says 197 Rhode Islanders are hospitalized, which is a slight decrease from the 201 announced yesterday. Earlier today, the state announced the $10 million loan program for small businesses. We've learned so many applications came in the first few hours that they've already stopped accepting new ones.
The state is now in its 5th week of remote learning. The governor has announced that the Rhode Island Foundation has committed $100,000 to get computers and Wi-Fi hotspots to kids in need. She also says they're working to set up more mobile testing sites at places like group homes and the inner city.
Eyewitness News reporter Kim Kalunian joins us now from the State House with today's other developments.
Well, the state has now tested more than 20,000 people, and close to 3,000 have tested positive for COVID-19. This as the number of hospitalizations has close to doubled in just the past week. But we have learned that people are recovering and are being discharged. Governor Gina Raimondo announcing hundreds of new coronavirus cases in Rhode Island on Monday, but she says it should not be cause for alarm.
We're now testing 4 or 5 times as many people as we were a week and a half ago. So obviously we're going to be having many more folks who are positive. And that's a good thing insofar as we have a more accurate picture of what's happening in Rhode Island.
As cases continue to climb, so does the death toll. The bulk of Rhode Island's fatalities, 55 of 73, have been associated with nursing homes. Among them, 19 at Golden Crest in North Providence, 16 at Oak Hill in Pawtucket, and 6 at Orchard View Manor in East Providence. Department of Health Director Dr. Nicole Alexander Scott says nursing homes need help.
If you are a retired nurse, a certified nurse assistant, a CNA, or any other healthcare worker who for any other reason is able to help in a nursing home right now, we need you.
She says the majority of Rhode Island's COVID-19 related deaths are happening outside of hospitals. As of Monday, 197 people are currently in the hospital, but since the outbreak began, 331 Rhode Islanders have been hospitalized with COVID-19, which means people are recovering, and roughly 134 have been discharged. Meanwhile, the governor says she's working on expanding testing even more, hoping to bring mobile tests to people who cannot get to the current drive-through sites. Widespread testing is a key to reopening the state's economy, something Raimondo and governors from other states like Connecticut and New York discussed on a conference call today, where they announced the creation of a 6-state advisory council.
Reality is this virus doesn't care about state borders, and our response shouldn't either.
And when it comes to public schools, Governor Raimondo says she expects to have an announcement on the rest of the school year coming up later this week. At the State House, I'm Kim Kalunian, Eyewitness News. Well, we know there's a lot of information that comes out of these daily briefings, and sometimes it's hard to keep track. So today, Dr. Nicole Alexander Scott took some time to address questions about current and cumulative hospitalizations, the number of recoveries, and also data on how cases break down on racial and ethnic lines. Let's take a listen.
The number of 197 people currently hospitalized compares to 331 COVID-19 patients in Rhode Island who have been hospitalized since the start of this response. That means that we have roughly 135 people who have been discharged home from the hospital. We know the total number of cases that we have. That total number has to be subtracted from people who are still in the hospital and people who have unfortunately passed away. The number that remains would be those who recovered after 2 weeks of time. And so 2 weeks ago, when we had numbers, the total was a lot less than what we have now. So we're waiting till we have enough numbers to be able to share that calculation on a regular basis so that it's something that people can respond to. But we know overall that it's the total number of cases minus the people currently hospitalized and minus those who have unfortunately passed away, with that 2-week time period that it takes for someone to really get through an illness and recover. The race ethnicity data is something that we have also been working diligently on. Some of the preliminary race data and ethnicity data that we have is of the cases that we've collected information on. Those who are Latino from any race are about 10% of the cases. Those who are African American, non-Hispanic, are about 3%. Those who are Caucasian, non-Hispanic, are about 10.9%. And the remaining races, non-Hispanic, are about 1.4%.
And Dr. Alexander Scott says they're still investigating the racial and ethnic backgrounds of the other local cases. Meanwhile, today, Governor Raimondo says she's working to expand testing even further by bringing sites to the inner city and introducing mobile testing that goes to people instead of the people coming to these drive-through sites. The governor also says she expects to have further guidance on the remainder of the school year coming up later this week. At the State House, I'm Kim Kalunian, Eyewitness News.